My name is Tammy Chambers with Health Partners. Thank you for joining this webinar today, Nourishing the Mind and Body, Affordable Nutrition Approaches for Diabetes and Depression. This webinar is presented by a collaboration of Minnesota Health Plans working to improve diabetes and depression care in Minnesota. This webinar will be recorded and available for later viewing on the Stratus Health website. We will have an evaluation for you to complete at the end of today's presentation, and it will appear automatically at the end of the webinar. By completing the evaluation, you will receive a certificate of participation. Today's presentation, you can enter your questions in the chat box, but we will do a Q&A at the end. Our presenter today is Lauren Plunkett. She's a registered dietitian and certified diabetes care and education specialist with over 31 years personal experience living with type 1 diabetes. Her professional experience includes pediatric endocrinology, performance nutrition, and diabetes health coaching with expert knowledge in continuous glucose monitoring. In addition to her private practice, she serves as a writer, public speaker, indoor cycling instructor, and authored the award-winning book, Type 1 Determination. A cornerstone of Lauren's outspoken work is educating individuals on the benefits of plant-based nutrition for preventing and improving chronic conditions. She is also one of the hosts of the Green Glow Lifestyle podcast, and you can learn more about her work at the link shown there. Thank you again, Lauren, for presenting today.
Thank you, Tammy. And thank you everyone for being here and taking time out of your Tuesday to, hang out with me talking about diabetes here on a subject matter that is incredibly important and kind of close to my heart also because I've had type 1 diabetes for so long. It's everything that I know, really. I often refer to myself as a clinical kid. I grew up in the clinical system and I kind of became the person I needed the most as I grew up and realized that there were a lot of things I still needed to learn about myself to save myself, to give myself a better life. So here we are, nourishing the mind and body, affordable nutrition approaches for diabetes and depression. I'm going to give you a lot of ideas today, and I'm going to say a lot. So if you have questions, if you have other thoughts, my virtual door is always open. My email is always there, and I'm currently working on expanding into some workshops for folks to support them a little bit more in this particular space. So here's my email, website. You can contact me. LP Nutrition Consulting is my practice, but also laurenplunkett.com is another way to get there. I'm also certified in some specific training in type 2 diabetes remission. And reversing insulin resistance is something I'm going to talk about today as well, because it's all relative when it comes to holistic, whole body. Everything in diabetes affects all of us, and all of us affects diabetes. So let's dive in. We've got the learning objectives here. And today we will examine emotional challenges often experienced by people with diabetes to initiate nutrition strategies that can improve insulin sensitivity and quality of life. We are all a team in this. So wherever the seeds are planted, they are all relevant, and it helps us work together. Whether you're a dietitian or not, or a diabetes educator or not. So why are Americans struggling? Well, certain lifestyle choices, they do increase the risk of developing metabolic syndrome. We have these lifestyle factors. Like I had said, everything is kind of connected here in diabetes health, chronic stress and depression. The studies on loneliness have been coming on strong since the beginning of COVID, and we're still really facing a lot of this dilemma. And these feelings inside of our body, our emotional body, it does contribute to systemic inflammation. Also, consumerism. And what I mean by consumerism is not just food, it is information, taking in a lot of things that create stress in the body in a world that's pretty heavy right now. So foods that drive disease connect these things together. The sugar, fat, salt, alcohol, food is a reward and relief to try to soothe and try to treat a emotional problem by temporarily feeling good through certain foods. And that can even relate to a lack of physical activity if that's present to begin with. And there's a lot of short-term thinking that happens in diabetes. It happens in diet culture. It happens in, I'm fed up, I've had enough, I'm going to try a quick fix. So oxidative stress, unhealthy food provokes the immune system But not only the unhealthy food, but stress can be that trigger. So you can see this feedback loop of things relating to each other, damaging our microbiome, which is the environment inside of you. I'll talk about that a bit later too, and why this is so relevant to depression. And impaired cognition is also in that relationship. So it's not just microbiome to depression, but it's also emotional health and brain health that we are relating here in that reduced quality of life. And all arrows you can see lead to insulin resistance. What is insulin resistance? Well, it's an intramyocellular event, which is very much the defining intra, inner, myo, muscle, and cellular, leading to the diagnosis of type 2 diabetes. What is getting into these cells now, these lipids, these fatty acids, these little yellow particles that you see here? This is not related to body size. This is not related to BMI. This is related to dietary fat, specifically saturated fats. It's really important that we understand the connection here to nutrition and insulin resistance, because it may not be what we've thought over the years, specifically related to the diet advice that has been historically quickly recommended for treating diabetes, which I will talk about as we go on. So what you're doing here is you're seeing a cell. This is a muscle cell, but also these little lipid particles can get into the liver as well. I think of them as causing traffic. They start to clog up this pathway. Lipids entering the liver and the muscle where we don't want them. They want to live everywhere that we do not want them to go. Tissues become inflamed. The beta cells that make insulin become toxic. They don't operate as well as they once did. They make insulin. They're so important. So now, if you're thinking to yourself here, you can throw that into the chat. What hormone must glucose have to enter our cells? The answer, insulin. And I think of insulin kind of like a taxi. It's like your Uber. Glucose is trying to move, or it needs to move from the bloodstream. It needs to get into that cell. You can kind of see in the picture here. Glucose needs to get into that cell to be used for fuel. The mitochondria are little powerhouses. They are so important, and we want to treat them well. Mitochondria operates efficiently because of nutrition. Nutrition is what keeps us going. Nutrition is what keeps us insulin sensitive, or nutrition will actually create the insulin resistance in the first place. So when someone is told that they have pre-diabetes, what I wish they would hear is the doctor says, let's review your labs. And what we're looking at here is insulin resistance. Would you like to know how to reverse this? Because there's a good chance that you could. And if we were to throw in the language of prevention in that moment when that A1C hits 5.9, instead of, well, we're looking at prediabetes, let's just wait here. You could, change your diet, or we'll just go ahead and prescribe metformin. What I want to hear is you're looking at insulin resistance. Would you like to learn how to reverse this? I have someone that I can refer you to. That would make a huge difference in our road towards preventing type 2 diabetes, is to get that language started early. So now we know that there's a bit of a traffic clog happening here. There is traffic on this highway to help insulin become more efficient. And in fact, this is the same type of particle, these little fatty acids, that also relate to cardiovascular disease. So there's a lot of things that we can do to try to prevent it from getting to this point. There's a system-wide solution. Western diets and chronic disease. Well, food is often calorie dense as opposed to nutrient dense. We want the nutrition. We want high nutritional value. But instead, what we've got is high in nutrient poor fast food. Convenience kind of drives a lot of our choices, and the high intake of added sugars goes with it. However, it's really, really vital to realize that, if you bake, what makes sugar taste good. That people aren't just grabbing a pack of table sugar and eating it straight away. If we want to eat sugar, we need butter or oil to make it taste good. Half the calories from chips, pastries come from fat. So these foods that could get called carbs, it's not completely incorrect. But these foods that we think cause a significant part of the problem that we call carbs, it's partly because they're half fat. They're half of that saturated fat that drives insulin resistance. The excessive intake of saturated fats also comes with oils. Low in fiber. Diet fads and fear of carbohydrates is rampant in diabetes. And we need to remember that fiber is really the solution here to reducing insulin resistance. Veggies are carbs, beans, whole grains. Also, these foods are a lot of staple of different cultures. Really important that people continue to have that relationship with some of their cultural foods, and they also realize that fiber isn't the enemy. I always tell my clients, I want fiber to become your favorite F word. We're going to talk about it a lot, and it's a good reminder for you when you come to the grocery store and you start making selections. Fiber forward. We also see a high sodium content, and that repetition trains our brain to want more. Large portion sizes, frequent overeating. If you've ever been to the Cheesecake Factory, you know what I'm talking about. Also, it's the way that menus are designed. They are not designed to encourage us to be healthy. Restaurants are not part of the healthcare system, that is for sure. And what you see at the very end, which was really sad, are super overpriced veggies, and they're typically coated in oil. Also, in our culture right now, people are seeing TV shows glamorizing excess alcohol, excess meat, cheese, excess protein, huge portion sizes. We're not. There isn't a great model right now for people. Social media, marketing, people are really struggling here. And it's not all because they're making their own choices, it's because they're being influenced. What is lifestyle therapy? It addresses habits and opportunities. Now, acceptance, the commitment, and accountability. This is what we want to be able to present when it comes to lifestyle therapy. Lifestyle medicine, it focuses on prevention and root causes of disease. Now, this is what I do in my practice, is it's really based in what are we talking about with lifestyle? Which things are all related? As we know, there's so much connection here. Evidence-based lifestyle therapeutic approaches, what do they include? Well, plant predominant whole foods. We aren't using terms in this. We aren't using words like vegan. We aren't even using words like vegetarian. We're using words like we need to eat more plants. Here's what this looks like. We're trying to get more fiber in your system, and here's why. Regular physical activity, sleep, stress, avoiding risky substances, and also that positive social connection. Within lifestyle therapy, what we know is that all of these things help to treat the whole person. So it's all on the table. Now, medical nutrition therapy is part of what dietitians do. And what I really love about this practice is it considers mental and emotional well-being related to food choices. So we're always counseling, we're always coaching, and we're always working on our communication. We are not born exceptional communicators. We get better because of practice. And that's another reason why it's important to see that we're all in this together. We're all kind of a team in this. So, lifestyle medicine, just a bit of a study here, a brief review. This quote is quite interesting, and I'm curious what you think about this. This study really gathered that 80% of the population wants to live in a better state of health, but doesn't know how to pursue it. I'm really stuck on this. I think this is really telling of how we've developed education within the healthcare system, within diabetes management, within diabetes prevention programs. There's a lost in translation, or there's a lack of a connection. And I think that lifestyle medicine is the key to being able to crack some of this open and to really reach people in a holistic way. So within diabetes management, adopting lifestyle interventions, it can improve insulin sensitivity, which we've gotten into just a little bit here. And with some patients achieving remission of type 2. Now, what does that mean? Your A1C reaches 6.5%, less than 6.5%. Without diabetes medications for 3 months. Once a person has reached that point of maintenance, they are now in a remission place of within their labs. And what's really exciting is that when people reach this point and they realize that some of the habit changes that they made related to nutrition, exercise, their sleep, or their stress are what really drove them to find a way to live life in a state of remission. There are mental health benefits we've learned from lifestyle medicine, and also the health care cost reduction by focusing on prevention and reversal of chronic diseases. There can be a significant reduction in healthcare spending. So when we think about mental health, the CDC report out of 2023, 60% rise in depression over the last decade. 1 in 5 adults have been diagnosed with either depression or anxiety. Our external world is driving a lot of this. But through lifestyle therapy, we may be able to help someone find their own solutions as we help to guide them. So a slide here on GLP-1 medications. This seemed like an important time to talk about what they actually do and what their role is within the world of lifestyle education, is that they combine appetite suppression with this glucagon receptor activation. So that is their full name, this GLP-1 RA, this receptor agonist. We have these receptors all over the body. These receptors play a role in regulating blood sugar by stimulating insulin to help regulate those blood sugar values. But they also suppress glucagon, which is a hormone that can be secreted. If it suppresses glucagon secretion to lower blood sugar as well. And you can see there's a feedback loop starting to happen. Receptors in the brain promote weight loss via the hypothalamus. Now, this is amazing because the hypothalamus, this little tiny guy in our brain, is part of the pleasure center. The pleasure center has a few other pieces involved, but it regulates hunger, thirst, sleep, and mood. It has a substantial impact on so much going on in our system at one time that you can imagine. And if we've got all these receptors firing here, no wonder the GLP-1 medications are helping people to see food quite differently. But what we also know is that when a GLP-1 medication is prescribed, lifestyle education is a mandatory piece of this. And only 5 to 7% of people with diabetes are actually getting that education. So there's a huge miss here when it comes to maintaining weight loss or creating long-term habits that support the ball that the GLP-1 medication may have gotten rolling with weight loss. So with the hypothalamus is the satiety center, enhanced feelings of fullness. They include poor appetite and discomfort. So some of the side effects can come up here. Part of that is delayed gastric emptying. So feeling full sooner, resulting in small portions. As a dietitian, something we really worry about is actually malnourishment. Someone still needs to feed their whole person. Glucagon, it's the hormone that's released to prevent low blood sugar. So these little pieces to remember here. And again, the hypothalamus, big job to do. When mood is attached to that, you can imagine that there's never just one moving part. There's always a collection. Okay, well, what does the World Health Organization say? That lifestyle changes are the best way to prevent and delay the onset of type 2 diabetes. How? Insulin sensitivity. It supports metabolic health by reducing risk and delaying disease progression. So it can help somebody on a holistic level, mind and body and spirit, is to reduce insulin resistance through nutrition. Here's the link between diabetes, depression, and nutrition. Well, which came first? You guys remember this blizzard and how this was advertised? It blows my mind that we as a society are okay with this idea, that we don't see the problem. And it just shows the genius of food marketing to be able to convince us that you can turn something like that upside down and it doesn't move. So when that goes into our body, we don't think that far ahead of what do these foods actually do when they're inside of us? Are they doing good things for us? So which came first, the diet or depression? They are absolutely linked. Diabetes and depression each increase risk. Let me go back a second here. Diabetes and depression each increase risk and severity of the other. So depression reduces motivation and consistency. Medication use, glucose monitoring, diet, physical activity, quality of life, and appointment attendance. So we know that there is a profound relationship here between showing up for yourself when mental health is challenged. Collaboration. My slides are getting a little bit silly. Here we go. All right, collaboration between diabetes care and mental health services, it's vital for improving overall outcomes in patients with diabetes and depression. What's also very important is just us being able to ask the right questions to help people kind of bring some of the things to the surface that they want to take into therapy, can really help them work through their relationship with food. Also, food noise is a comment that it comes up quite a bit these days with the use of GLP-1 medications. And these symptoms differ across the lifespan. Younger adults may experience more emotional distress, while older adults may show cognitive or somatic symptoms, and then non-pharmacologic treatment are beneficial. So here's where we think about the lifestyle factors. Cognitive behavioral therapy, but also exercise, looking at the stress triggers, the amount of that stressful load in somebody's life. It can help improve both mood and glycemic outcomes when we go after those stress factors and try to reduce their impact. This slide is, I feel like I created this one from like the depth of me, the emotional depth of diabetes. So people with diabetes, type 1, type 2, there are many diagnoses these days of diabetes itself. What are the consequences of pessimism? How we think about our lives, hypercriticism of ourselves. This is a number-driven disease. We're often assigning our self-worth to a blood sugar value. And then comparison to others, which unfortunately goes on social media like crazy these days, with people posting their A1C. That can be really harmful. So what can that do? Well, there's a decline in physical and mental health. The rates of depression can even go up from this position here. And remember, this is the way we feel about ourselves. Burnout is a huge factor, and then it can affect our relationship with food, deciding that we're going to withhold on some medications and then feeling really isolated and misunderstood. The range of feelings that I have here on this list, I will tell you that this can happen. Every single one of these emotions can happen in one day for somebody with type 1 diabetes. And certainly a proactive person becomes even more aware of how they feel because they're trying so hard to control everything. And when I see things like self-worth tied to data, I see someone becoming so sad because of what those blood sugar values are, because of what their A1C might say, is to intervene on the sadness as soon as possible, seeing that chronic anxiety can lead to depression. Conversely, depression can increase anxiety. So there are interventions needed right away when you see that diabetes is beating somebody down, especially when they're putting the effort in. So where does emotional health fit in here? Well, behind this, which is anger, which was and has been a very strong emotion in my life of having type 1, is that distress can be the greatest barrier to then making a lot of lifestyle changes because inflammation goes up, insulin resistance, blood glucose, it affects us systemically with heart disease risk also increasing, weakened immune function. And then we get into the lifestyle factors that this emotional health can have something to do with, like sleep and appetite and exercise patterns. The impact is great. And self-care behaviors also. So something for you to think about, audience, is that if you think about your own stress levels, is it acute? Are these quick moments in time where you're able to restore a healthy feeling in between moments of stress, like moments of needing to be somewhere on time or being stuck in traffic, and you're able to kind of come back into yourself and be okay? Or do you feel like your stressors are chronic? They are constant. They are all the time. They're affecting your sleep. You're never really able to let down from that. You may now realize that stress could be your biggest barrier because it's chronic. And it's something that you really need to focus on, trying to improve in your life and finding some tools here so that you can cope and you can start to see it a bit differently, see your health a bit differently in a space where maybe stress wasn't impacting you as much. It really is critical that we look at this. No one deserves to live a life of chronic stress, especially if your external world is causing it. And these are things that you might be able to change. Okay, let's get into that microbiota, the environment inside of you, microbial diversity and intestinal integrity. Now, I think of this as a rewilding. If anyone knows this word, what rewilding is, it's like taking a completely bleak environment where nothing grows, or farmland that's stripped of all of its trees and wildlife. And what you're doing is you are replanting, you are rewilding, you're bringing back the wildlife, you're bringing back the pollinators. This is what we want to do with food inside of our bodies so that it thrives. Gut microbiota is a key component to human health, and there's a lot of different influences: genetics, health status. In fact, you share an office with people, you can impact each other's microbiome. Biota diversity, it strengthens our immune system. Diets high in either fat or sugar can impair cognition in humans. And diets high in either fat or sugar, as we know, have a direct link into insulin resistance. Short chain fatty acids is something SCFA. Remember this. It's going to come up here a little bit more. They provide the widest range of disease fighting microbes. There aren't any short chain fatty acids in fats, not in saturated fats. Now, here's where we can start to see a cycle. Disturbances in microbiota composition, they cause the dysfunction. This relates to cognition, depression, anxiety, obesity, and also eating disorders, anger. So think about the hypothalamus. Look at how the impact is that if we lack microbial diversity because we are not rewilding our system, we are not treating our microbiota with everything it needs to thrive with all of those good bugs, we are impairing our system if we eat a high saturated fat diet, like that slide with the upside down ice cream. And that in itself is a impactful loop between our gut, our mind, our emotions, and diabetes itself. Food is the problem and the solution in endocrinology, in diabetes health, in human health in itself. So here's another little study for you here on these short chain fatty acids as key components of the human gut microbiota. Now, this statement is kind of a mouthful, but one of the most relevant therapeutic pathways of microbiome modulation. It includes restoring those short chain fatty acids, microbial metabolites that are essential for human health. So simply put, good bugs. We want way more good bugs inside of our body that help to support our immune system. And that gut-brain axis, research indicates that the gut microbiota can help regulate brain function through gut-brain axis. So this is a highway. We can eat ourselves into this position. So that's what we want to learn to do. What we absorb internally and externally influences metabolic health. That's not just food, what we are absorbing. That goes back into consumerism and allergens, poor quality foods that are nutritionally poor. They persistently challenge that intestinal integrity. So here's the $1,000,000 question. How do we consume more short chain fatty acids? And what we're going to get to is how do we do it affordably? How do we present it as possible? And how do we make it taste good as well? It can be a big change for people. Well, the research says eat more plants. Short chain fatty acids are from fiber. Fiber is key. Again, favorite F word. We can lower inflammation by eating foods that are rich in fiber. The veggies, the fruits, the legumes, whole grains, nuts, and seeds. This is a huge category of foods. It's foods from the earth. Critical for regulating blood lipids. You're kind of starting to see, wow, this isn't diabetes we're talking about anymore. Not just diabetes. This is cardiovascular health. This is women's health. This is men's health. This is mental health. What we also get from short chain fatty acids, why there's so much magic here, is that we get a range of antioxidants and vitamins. We get a ton, like 10,000 compounds of flavonoids. And what these guys do is break down to protection, protecting our tissues, helping athletes recover, not just helping to prevent disease, but also to improve disease. Eating this way probably saved my life. And I kind of just stumbled into it 17 years ago. And just a little quick note on prebiotics and probiotics. Prebiotics don't break down. So this bacteria grows, it thrives. It's also from the same category of foods. There are supplements available, but you're only going to get a few strains of those prebiotics. And we want lots of those strains from the actual food source. The same deal real quick about like fiber as a supplement. Fiber as a supplement helps with regularity. But fiber as a supplement isn't going to enrich our system with all of the biota that we're looking for. And probiotics are the live microorganisms that feed on prebiotics. So prebiotics are probiotic food. Sauerkraut, kombucha, miso soup is a really good one. Some pickled foods. Basically, if it's stinky, it's great for you. If you feel like you have to eat it outside, fermentation is probably your second favorite F word now. That is a fastest way to enrich the biome is with that fermentation because the biota is expanding in that process. And supplements are available again. They're not necessarily better. We want to eat our way there. So how do you support people to engage in health goals? Where do you start? It starts with the objections. Statements often begin with, I don't, I hate, I can't. And if you stop for a moment and think about when you ask people how they're doing. They may just dive right into saying things that they're struggling with. Now, these objections are often self-limiting beliefs, and they're really important to address because people set themselves up because of an impression they may have, because of a way they felt in the doctor's office, because of something a family member said to them. And we're going to get into this in a few more slides here about reframing. Well, we're already here in reframing, but we're going to continue to work on reframing a perception that someone has about having diabetes. Discussions need to also be revisited. They're not just going to go away. It's not a one and done. So if you hear someone say healthy food is too expensive, you get to ask questions. Tell me which foods you're trying to buy. What's out of budget? I don't cook. I don't know how. Well, there's something I call microwave chef. Do you have a microwave at home? Not everyone might have a microwave at home, and there are other ways to work with the pot and pan as well. So, how comfortable are you with frozen and canned foods? You're asking questions to help someone see past the initial objective statement. My family won't eat healthy food. Oh, well, it sounds like you want to, and you want your family to support you. Tell me more about how you've been eating as a family. And you may not all have the perfect answers to these questions. That's not really what it's about. It's about helping them to see through the problem that they presented to you, and you're helping them to kind of work through this. And you're kind of call it informational interviewing, but I think of it as a optimistic coaching. We're really trying to present a vision to someone that's different than what they currently have. Self-blame. This is big in diabetes. And not a good day goes by that I don't hear something like this within mindset coaching. Someone just says, I can't lose weight. The emotion that they're actually expressing here is the feeling of failure. Saying, I'm so bad with food. That's distress. That could be diabetes burnout speaking. Another one, my parents are diabetic. I'm doomed. The word, diabetic professionally isn't something that we use, but we're going to hear people identify themselves as the disease rather than having it. That can be an expression of hopelessness. And also, my A1C is bad. Say they just came from the doctor's office and they say diabetes sucks. Diabetes is all the problem. It's a bit of a victim mindset. And it's not that we're not validating the feeling, but what someone is looking for when they make a statement like this is they're seeking confirmation. So something that's not encouraging is, I know it sucks. That I would discourage you from saying. What would really work is, I'm hearing you say this is really tough right now. Can you tell me more about it? Let's move them past this doom and gloom as fast as we can. Your next question is how to help them move through it. Negative language drives poor outcomes. This research paper from Jane Dickinson was one of the most important pieces of research that came out for me because it said a lot about my upbringing with diabetes. And I was like, finally, language really matters. Communication is so important, and how we talk about diabetes can completely change someone's life for the better. So what do you do if you have a bad day? Let's say this happens. You got a stressful day at work. You skipped lunch, 8 voicemails from your family. Like you might be feeling this right now. Like this happens, you're stuck in traffic. You missed a class you really wanted to go to, and you need gas. Okay, this can happen to anyone. You weren't hungry. You stopped for gas, and the gas station told you that you were. How do we overcome these things? Here's some conversation starters with folks that you might be working with if this starts to come up. If they're feeling like they can't avoid foods that they're around, if they feel like the world is making the choices for them, if they feel like I had a plan to cook dinner tonight and then I got derailed because I was so stressed, and then that root beer float spoke to me. Here's some things you can help someone see. Do your emotions drive your appetite? What were you feeling? And then they're going to start to tell you about it. They're going to talk to you. I was stressed. All this stuff happened. I was so busy and I didn't get lunch. Are you an all or nothing thinker? Now, this is very common for health seekers, for people that are weight loss seekers, is the I have to do everything right or I'm wrong. And that is not what lifestyle therapy is. Lifestyle therapy is looking for solutions in the relevant space that we're in right now. It's, what did you do today that really worked for you? Let's create a plan for tomorrow. Let's create a menu for the week, maybe. It's not everything is perfect or you're a failure. That relates to shame, shaming yourself about food choices. And that can also be a result of decades of having diabetes and feeling like they're never getting on top of it, even though they're following the same nutrition advice all the time, which is often low carb. That is not high fiber, and we are going for the fiber at this point. So, if we really think about it historically, in diabetes care, that low carb recommendation is exactly the opposite of how the microbiota would flourish because vegetables and fruits and whole grains, they're carbs. Beans are carbs, they're rich in fiber. And then, what is your hunger like on a stress free day? This is an interesting question that people don't often go, a stress free day. And right there, you have a talking moment. You have a teaching moment, even when someone hardly recognizes what a stress free day feels like. But then again, you're bringing them back to something optimistic. External influences, like what we just saw at the gas station here, they can really lead to all of this internal blame and shame related to depression, relating to those feelings of anxiety. So, how do we break free from those negative influences to make way for new habits or to help someone see that new habits are out there and that they can engage in them? We want to help them see that. Helping to determine boundaries about what you allow to influence you. And now, as an audience here, you're starting to kind of internalize this, which is great because when you think about your own habits, you then become really quite good at helping other people work through them too. So we are our own best examples when it comes to living a healthy lifestyle. And then we ended up in a position where we can talk about it more and give people these little teaching moments. There are things to limit, in a sense, if it feels like it's influencing you in a negative way, and being able to say to people, are you listening things? Are you influenced by things? Are you getting food reward programs mailed to you all the time that tell you to go to Arby's? These are things to start to scaling down. And I love the idea of establishing a nutritional moral compass, just knowing there are foods I will not put in my body anymore. They don't help me. They work against me. I want to eat foods that work for me, not against me. I want to rewild. I want the pollinators to come back. I want a healthy body, and there are foods that I will not eat because I know they don't make me feel good. People get to do that. You get to declare, you get to make boundaries, even with food. So here's some more discussions that you can have. The grocery list, that's where I always start. Home kitchen assessment. Take inventory of what's in your house, in the kitchen. And I'm going to show you what the M&M is, the menu and movement calendar, where everyone under the same roof can get involved, and focusing on abundance of nutrients rather than restriction. We are now completely switching around how we talk about carbohydrates. And what they are is anti-inflammatory. These foods promote healing. They promote insulin sensitivity. This is big. This is like vital to reframing within lifestyle, nutrition, lifestyle education to help people overcoming and unlearning some of the things that haven't been working very well for them. Because when we just say, eat low carb, see you in 6 months, which is often what people hear, what they're kind of influenced to do. It can come from their family, it can come from the medical practice, but what it results in, people eat a lot of high protein foods, and typically it's meat and cheese, it's saturated fats. Those portions are undetermined. Nobody really knows how much to eat. The sugar cravings go way up because you're not getting enough glucose to fuel your cells, fuel those little mitochondria. And then people feel ashamed because they had a sugar moment. And there's such nutritional confusion because fruits and vegetables, I don't know on what world fruits were ever interpreted as being unhealthy for someone as a natural source of sugar, because they're excellent. They're loaded in nutrition. Also, when people hear eat more protein, which is out of control right now, with protein, our proteins will use it or lose it nutrient. We only absorb so much at a time. So that again increases calories from saturated fat and increases calories from foods that are not driving insulin sensitivity. They can lead to insulin resistance. They're inflammatory. And also, protein is individually based. It needs to be calculated based on someone's health goals. It needs to be calculated based on an activity level, that desired body weight, to help someone actually get enough, but not too much. We don't absorb every gram of protein if we don't use it, but we will take in every single calorie. Eat more plants, eat more fiber. What does this say? It leads into addition over subtraction. Eaters focus on food quality and color. There's so much color when it comes to eating more plants. And people always have the choice of their protein choice. The protein is a choice, but there is protein in every single plant. It adds up as variety increases, so does the protein. Food is energetic nourishment. So we want to think about food should work for you, not against you. We don't want to be ashamed. Also, the biodiversity is expanding. The short chain fatty acids come straight from those plants and fiber. We're enriching the biome. Here's a language check. Identifying those fiber rich foods I had mentioned earlier is where is the fiber and where is it not? And a lot of those pastries are half fat or the whole food plant based. There's lots of color and they're grown and harvested from the soil. The twist of perspective here, I call this revelation work. We're developing a positive passion, meaning you love yourself. This is self-love. This is self-care. We can help someone see this in visualization. So if you woke up tomorrow in your ideal state of health, what would it look like? What would it feel like? You're helping your patients see the changes they want with the questions that you ask. That goes back to that original quote. People don't know how to pursue living in a better state of health. We need to help them see it by reframing, getting excited about the daily pursuit. What are you cooking today? What did you make yesterday that you were proud of? Encouraging self-awareness. I'm a firm believer that diabetes can teach us more about our bodies than we've ever had the chance to learn before. And there's a lot of things that we may need to do to try to work through our mental health in an effort to even get to the nutrition choices that support us, but they can work in tandem. Getting together with other people that are also living with the same health goals, like support groups. And those barriers and standards, developing the standards about what you will eat and what you will not. We're changing the perspective on food. So here are some affordable nutrition strategies. Now that we know that fiber is what we're looking for, how do we get more of it into the house? If it reduces the risk of type 2 diabetes by 20 to 30%, this will get people excited. This will perk up the ears. This really gets people thinking, wait a minute, I was told not to eat these foods. And you may not be in a position to say, don't follow those recommendations, but I sure as heck am. And I'm the first person to say, we are reframing carbohydrates. Let's talk about what insulin resistance is and how it's created. And it's from dietary fat really clogging up the cell. So what does fiber do? It kind of helps to move some of that clogging out of the system. So as we eat fiber, it not only picks up things like bile acids and excess cholesterol and excess hormone, but those saturated fats, there are those intramyocellular lipids, they start to break away when we eat less saturated fat. Dietary fat is still important. Nuts and seeds, that omega-3 comes from nuts and seeds. But what we're looking at here is trying to get more of these whole fibrous foods in the body to pull away some of that resistance so that we can excrete it out of our system. These are canned foods. These are 90-second grain bags that you can pop into the microwave. These are farmers market vegetables. These are a bag of apples. You can go Walmart, Target. Plant Strong is one of my favorite places to get low added sugar granola. And many of their granolas currently are priced very similar to Walmart. I also have a discount code to Plant Strong. I have a whole bunch of references on my website where Plant Strong is listed. And Aldi is fantastic for produce. It's my favorite place to go for produce. So if you know that the people that you're working with, depending on where they have access to which grocery stores they're using, there are ways to help them navigate this. So it's a little bit at a time. This is not all or nothing. Did you use half the ground beef in your tacos as usual and pour in a whole can of black beans instead? That's one way to do it. You've reduced a significant cost because the meat is expensive. The beans are 99 cents. And now you're getting fiber where you wouldn't have gotten any to begin with. So there's little strategies here in adding a little bit more at a time. And people often start to reduce the saturated fats just because they're fuller. They're eating more of the fiber. Something I do want to say about this is there are ways, within a toolkit here to quickly go on to Google to ask questions like, what can I make with beans? And you're going to get a huge list of ideas. Also using ChatGPT that I have used to show me 15 high fiber items at Kroger, and now show me 3 recipes as to what I can do with them. So even while you're on the phone with someone, you can get on the computer and you can start developing something for them in a flash. at their particular price point as well. So here's a quick start fiber foods list. This is the way of thinking. This is the direction that we're going in. Bean chilies, crock pots full of flavor here with tomato and three bean salads. And the thing is this is a tough way of thinking for a lot of people with diabetes to realize that these foods are not the problem. They are the solution. So we go slow. We go one at a time. We may work breakfast this week and we will work lunch next week. It's little bits and things that we can do in order to reduce saturated fat and get more fiber in the system. Flavor really is critical in herbs and spices. They're anti-inflammatories. They're great. Determining a daily food budget and then dividing it by 7. Determining a weekly food budget and dividing it by 7 can be helpful for people. Multiple locations also can be helpful. Knowing which grocery store you go to get the best deal or which one can deliver to you in your location. Canned foods, frozen foods, dry stock, those crock pots. There are tools that are really valuable to have in order to work with these whole foods so that they taste good. The garden at home, it doesn't take a lot of space to do tomatoes and basil. I've got a zucchini going crazy right now out here. Little things like this are there are items to ask people about. What do you have going on at home? What kind of tools do you have? Essentially, you're helping someone build an affordable toolkit. And keep that grocery list on your phone because you want it to be ready all the time. No, never doubt that someone's going to end up at the grocery store and they're hungry. You want to follow that list. These are all kinds of questions that you can ask someone within communication techniques about shopping. First step is we've got to get the high fiber foods in the house. If they're not around a person to begin with, then we're already in a position to fall into old habits. And this is all a part of the process. It's 2 days out of the week you're eating more fiber. Okay, fabulous. Show me which meals you're proud of. Let's try to create a few more. And so where do you grocery shop? Do you make a list? How do you choose? A food philosophy, certainly here in Minnesota, is it meat and potatoes? How'd you grow up eating? It's all in the process of reframing and rethinking how we look at food. Do you like to cook is an important one. People often think they're going to have to spend all this time in the kitchen, do all the chopping. It's so hard to eat all these healthy foods, but truly, it's not perfection. It is microwave chef. It is one little thing at a time to get over some of that food fear as well, and the process of it being kind of fearful. And so you're helping to create a grocery list for somebody, helping them to find these fiber-rich foods that are so typically very, very affordable. These are simple foods, and we can do a lot with them. What do you like? Tell me what you like. Give me some idea. It never fails that someone says, I don't like vegetables. And I start to ask them more about, how do you make that? What's in that? What do you like? And I find that they do have actually a pretty decent palate, what they do like. And I always commend them. I say, you like a lot more. You gave me the idea that you wouldn't eat any veggies, but you just named 5 of them that you are currently eating. And they'll often say, yeah, but those aren't the good ones. They're starchy. So that's also a process of reframing that mindset about fiber. Goals of effective communication. We're just trying to break down some steps for people to see. We have empathy for their lifestyle when we ask them these questions. Does this fit within your schedule? How long are you at work? It sounds like meal prep. The concept of cook once, eat twice is a fantastic way to show that you're kind of sensitive to what they're going through and how difficult it is to actually create food when the barrier, the idea that healthy food is expensive. We want to get down to why. We encourage the realistic actions, shared problem solving. This is, you can see in these questions, it just goes back and forth and back and forth. And then we're food swaps for healthier items. We're adding the fiber, we're adding the plants, and also those sugar-free beverages, little things that we can do at a time to enrich the biome. This is one of my favorite things to create is this habit tracking tool. Anyone can use this in your house. These are Dollar Tree whiteboards. Is what menu and movement planning is that individuals and families can kind of see what you're doing. So you can take that old-fashioned calendar and all you're doing is Taco Tuesday. Wednesday, we're making grain bowls. Thursday, we are doing soup and salad. Friday, we're going to make a big chili so that we have it over the weekend. And so it doesn't have to be something different all the time, but people will start to see this rotation in how they can simplify the selection. And when it's already there for them to create it, it can help them to avoid that drive-in stop, that fast food stop on the way home, when they know that the groceries are at home and tonight is soup and salad, or tonight is taco night. This is how you help people see that you've made it. You've got the plan. So I don't use the word meal planning. I use a menu. Let's create a menu for yourself. And within each one of these foods that you're used to making at home, how would you modify it so that we have more plants? So we revisit. And this is how we create insulin sensitivity and result in improving someone's mood, improving their energy, and seeing that they feel differently about themselves, which in turn relates to depression and anxiety. These are the pillars of lifestyle medicine. Just a quick review here. Solutions-based language, it leads to positive outcomes. Nutrition and exercise and sleep and stress and social connections, they are all related to each other in this big world that is diabetes. And being prepared to kind of pivot to the others. Like if someone says, I crave sugar because I'm not sleeping really well. Oh gosh, tell me what's keeping you up at night. We shift into sleep. If sleep is the main problem that someone is having that's affecting their nutrition choices, we talk about sleep for a little while. We can shift throughout these things because for me, everything leads to nutrition, and nutrition affects all these other pillars. So we circle back, we work through coping strategies, and we ask effective questions. There are free resources here. The American College of Lifestyle Medicine is really stacked with a lot of these free resources. Again, I've got a lot of stuff on my website too in a resource category. It actually is through the ADCES tab. So you've got you've got a preview that others don't have if you're looking into that tab for resources. And so I'm going to say thank you now. I think do I need to stop my screen here, Tammy, and open up the questions, or do you guys want to ask from here?
You can, we can do some questions now. A couple of
Okay.
things that came through the chat. They, at the beginning, you were talking about risky substances. Could you just elaborate on that a little bit more?
Yeah, certainly you're able to ask about habits with substances that could be affecting someone's diabetes. That could be alcohol. It could be marijuana. It's whatever they say, quite honestly, when it comes to risky substances. We know that alcohol in itself has a profound effect on diabetes health. So that typically is the one that we want to touch on if we are comfortable touching on that.
Okay. And then there was a question about when can remission happen?
Yes, diabetes remission. So what it is if someone is getting their A1C down and they get below 6.5% and they are continuing all of their diabetes related medications. So remission sets in 3 months after that. 3 months of a less than 6.5% A1C and 3 months of no diabetes lowering medications. At that point, they're in remission, and now it will be about maintenance.
Okay. And then there was a lot of like questions about like the Hmong population and Hispanic population and what's a good diet for them and how are there resources for them as well in talking to them. And there were some questions about that.
Yes, absolutely. So the within high fiber nutrition or within lifestyle medicine and counseling in itself, the first question is, tell me how you eat at home. What is your traditional diet like? And you're really letting them guide you through what their traditional diet is like and how they would like to eat. Traditionally, I will show this range of beans, veggies, fruits, whole grains. What here in this grocery item, in this list itself, what feels familiar to you? How do you like to build your meals? So it's less about trying to say, this is your traditional diet because of where you're from. It's you tell me what really works for you. Let's find out which foods that are high in fiber fit within your cultural diet, because you and yourself, you're going to know that what we're trying to do here is enrich people with these fiber rich foods. We're trying to create a healthy relationship between diabetes itself and the foods that are insulin sensitizing. So really starting with that grocery list, beans themselves and lots of vegetables. And if people aren't eating fruit, being able to introduce fruit. I think that what comes across quite a bit is the Americanization of that traditional diet. That's what ends up kind of, the beginning slide of what are Americans struggling with. I often see that people that have traditional diets from other countries, there are wonderful things about Asian culture, African culture. The foods themselves are often rich in whole grains. They're often rich in high fiber. It's when they come to America that they start losing touch with that. So if anything, we're in a really great role to be able to connect them back to some of those native foods that are super healthy for them. The American College of Lifestyle Medicine, the Physicians Committee for Responsible Medicine, that pcrm.org, I believe they have extended information on a number of cultural diets. They also have a lot of information in Spanish.
Great, thank you.
Mm-hmm.
And then we'll just grab a couple more because I know we have a little bit of time left here. There was a question like if a member says, I have diabetes for years, I can't go into remission.
Well, tell me more. I mean, truly, it's not us convincing them that they're wrong. It's us saying, where did you get that idea? Really,
Yeah.
when it comes to lifestyle habits, are you telling me that you are having a hard time believing that, you can be healthier? I think there's hurt in that kind of comment. Someone has really spent a lot of years feeling lost. I think there's so much more to shame than the first line that they give you.
Okay.
So explore it a little.
Okay. And then there was a question about organic versus non-organic. Your thoughts on that?
Nobody should feel like they have to eat organic. If affordability is the barrier, I want people to get more of these foods in their bodies, period. Going organic is if people have food sensitivities. This is absolutely where a dietitian comes in. It's got to explore a little bit more because it's going to take some time to figure out, is somebody having a problem with certain foods? Are they having a sensitivity to the processing, the way some of these foods were grown, right? Because we all have a lot of these chemicals in our body. We have all been absorbing things through the water. We have all been absorbing things. This is why everyone thinks they got a problem with gluten when they probably don't. What we actually have is a problem with the chemicals that are being absorbed through the protein that is gluten. We all have these chemicals in the body, and some people are more sensitive than others to those chemicals, but we don't have a great measurement for understanding how much and which one. But we can understand is if someone says, I think there's certain foods that don't agree with me. And what you want to be able to do is, okay, do you have a red light food list? Are you starting to write down some of these foods because they all might have something in common? Now you need to go talk to a dietitian because they're going to look at that and help you figure out how to keep your diet enriched without having to spend a ton of money on all the organic foods. However, there might be some foods that you want to buy that are organic because of those sensitivities. There's the Dirty Dozen list to help people understand which fruits and vegetables are the heaviest in pesticides. And then I think there's the Clean 15. And the Clean 15 is also a list where people can see that these are the foods that you don't necessarily need to buy organic because they are the most organically grown as is.
Great. I know we're at time, and there was another question about continuous glucose monitor and striving to keep blood sugar in a specific range. I don't know if you can do that in 30 seconds.
What's the specific question?
It was, how important do you think it is to use a continuous glucose monitor and striving to keep blood sugar in a specific range?
Yes, let me answer that. I think they're vital. I think they're extremely important. I worn a CGM for over 10 years. They teach people a lot and they can show us quickly. However, I am not convinced that enough medical professionals understand how to interpret a CGM. Again, I've been doing it for 10 years. And it is not easy. It's not simple. The word spike should never be used. A spike is not a spike. It's a rate of absorption. It's from point A to point B when someone is eating. So the word spike that people interpret from a picture on a glucose, that is not, what's really happening. I have flashcards that I use with people to help them understand what's going on here. So I think that CGM is extremely important, but we also really need to have probably better training
Okay,
to
great.
be accurate.
Thank you, Lauren. I know we're at time. Thank you, everyone, for
You're welcome.
attending. And the evaluation link is in there. And appreciate everyone's time today and have a wonderful rest of your day. Thank you again, everyone.